Hi, this is Dr. Prashant from Brief Medical. I thought I'll do a quick overview of the way I look at skin and the implications of skin health with looking good. The way I look at skin is rather simplistic, given that my training is that of a plastic surgeon and not a dermatologist. Having said that, the way I look at skin is, and the way I understand the structure of the skin, makes it extremely easy and effective for my patients to understand the problems they come to me with. So if you are interested in wanting to preserve the health of your skin such that it doesn't have wrinkles, that it stays plump, glowing, even toned, with no pigmentation problems, then keep watching as I go through the way our skin is structured and what you can do to preserve it for the longest time. As you can see in this three-dimensional representation of the skin, what we see on the surface has got far more complexity when you look at it at a microscopic level. So in this model, you can see hair sticking out of the hair follicle, the pores. You can see the dead layer of the skin. The skin has got an epidermis, which is from about this point to the surface, and in the epidermis the cells are actually born over here, and then they rise to the surface, and as they rise to the surface they flatten out, they lose the nucleus and become the dead cell layer that we see on the surface. So this process of the cell being born at the bottom of the first layer of skin, the epidermis, and then rising up can take anywhere about 6 weeks to 8 weeks, depending on the area of the body and the age of the patient. So what you see on the surface is this thick layer of dead skin cells, but the skin actually is generating itself from this basal layer or the germinal layer. Below that is all of the dermis, and then below the dermis is the layer of fat or the subcutaneous fat. This particular structure is the hair follicle, and these little bumps on the side of it, which is better seen over here, are the sebaceous glands which secrete the oils that lubricate the hair shaft as it comes on. So that is a way of understanding the skin. It's a fascinating structure, a rapidly evolving structure, but clearly quite a complicated arrangement of many little organelles. A simpler way of looking at the skin is as follows. Here is my simplistic way of thinking about the skin and its layers. So just like in the model, the epidermis of the skin extended from the dead cell layer to the place from where the cells were born. And just like the dermis was between this epidermis and the fat cell, when you look at this couch mattress, it has got a fabric which is protecting the foam. The foam is giving the bounciness and the support similar to the dermis, which has got your collagen and elastin and complex sugars which hold the water, the hyaluronic acid and stuff, which gives you the structure of the skin. And just like the fabric of the couch mattress, the epidermis protects the foam and the other structures of your body from the ultraviolet and the environment. So the outermost layer of the fabric is a layer of dead skin. And when you have got a pigment patch or a liver spot or a solar lentigen or a sunspot on your skin or even a freckle, what you're looking at is a stain in the fabric that originates at the deeper layers, and it originates from a cell called the melanocyte. And this little structure is meant to represent the melanocyte. And a rather neat way of understanding what the melanocyte does and why it is important to us, especially in terms of preventing or protecting us from ultraviolet damage, is as follows. I found this neat little tweet that this Twitter handle Empathy Art has sent out, and if you can see, this is a histopathological slide looking at the skin structure, and these red areas are melanocytes, and they have got these little we call them dendrites, or the projections, which are literally injecting or tattooing the surrounding skin cells with pigment to protect the DNA. But then they have gone on to do an amazing illustration where they've shown the melanocyte, and that melanocyte is kind of with its dendrites injecting pigment granules which are made up of melanin, and these pigment granules are sitting like hats on top of the nuclei or the nucleuses of the cells of the epidermis, in a way to protect, almost like an umbrella on top of the nuclei of the germinal cells of the fabric of our skin, protecting the DNA of these nuclei and therefore reducing the harm that ultraviolet energy can do. So basically, when you if you are a person who can tan, if you go out and you expose yourself to the sun, which you shouldn't do without taking care and having sunscreen, but if you were to go out unprotected, the melanocytes suddenly goes into overproduction and produces a lot of pigment granules, which it goes on to inject. And as there are more and more pigment granules building up in the fabric of our skin, you start having the tan or the brown color to your skin. So I hope that makes it a bit easier to understand how the skin works. Bye for now. Thanks for the listen.